Hi, Dr. Henry. I wanted to ask you, in keeping with what you just said, we're still hearing from parents who say it took up to 7 days to find out that their child may have been exposed at school. And you mentioned last week that there are efforts being made now to try to report that information in a more timely manner. Where are things at now in trying to get those exposure notices up as soon as possible?
Yeah, so our focus is obviously on making sure that the families and the school community is notified as soon as possible and that those are posted. And there's been quite a lot of work with the school districts, with the Ministry of Education. My colleague, Dr. Reka Gustafson at BC CDC, is leading that with a team particularly focused in Fraser and Vancouver Coastal, where we know most of the schools and the transmission events are happening. But it is important across the province, and we are making progress in terms of catching up. Sometimes it's a challenge because it may take time before somebody is tested, before we recognize that they're in a school situation. So it is not always possible, and now because we give people text messages and they may get their own results and share them with people before public health is even aware. But that's important. We now know how to manage these, and I know there's tools that are being developed and shared with principals, with schools, with families, so that if you do get that notification, you know what to do to keep your family safe and to know what it means with an exposure event. The other thing that we're looking at, of course, is the data, and it's still, though we have quite a lot of exposure events where people have been in the school setting, there still is very rarely transmission in those settings. And if it is, it's mostly to one or most two other people. And we've had very few outbreaks, as you know, and we're trying to learn from all of those. So it takes time, but it is getting done, and I'm really impressed with the work that's been going on so far.
Do you have a follow-up, Marcella?
Yes, just regarding and this is what you actually talked about a few minutes ago, but the extremely loud voices who say they don't trust your science and they keep accusing you of deliberately hiding data about what's really going on. What can you say now to try to calm those people down? Because I'm inundated with messages from people on Twitter and other social media who seem to think that you are avoiding questions and that you're trying to deliberately hide information. And you touched on it a bit about what the data is showing, but where is the data proving that transmission in schools is not happening or not happening frequently?
So can I suggest that maybe you don't follow Twitter quite so often? But, yes, it is important. And we have, from the very beginning, been open in this. And people send me all of this stuff as well about, people who are expounding at city council meetings here and there and letters about it all being a hoax. But you know what? This is very real. Ask any of the families who have lost a loved one how real this is. And we do share the information. As you know, we've presented the modeling in detail. We've presented the maps in detail. It's posted, and I would refer people to the BC CDC website. On the dashboard, you can look at each region by age, by numbers per day, and then every week we put out a weekly surveillance summary that has age-related information, it has geographic information, and it has information that we've posted before on exposure settings as well. And yeah, it is a challenge, and part of the challenge that we've had is as we've had more and more cases, several hours to go through with somebody where they might have got it, what they're doing, what they need to do, who they had contact with. And this is a time when it's still very stressful for people. We know that people are worried when they get infected. Even young people are worried because we know that some young people will have have severe illness and end up in hospital. And thankfully, we've had very few deaths in young people. But that has not been the case in other parts of the country and the world. So when people are worried about their own health, they want to know what to do for their own symptoms, and they want to get that information. So we don't systematically collect all of the information that we'd like to, like information on ethnicity, and disaggregate it by race and income and all of those things. So we have to use other measures to get at some of that information. And we present that in the modeling, we present that in the data that we got from the survey and from other ways of trying to get understand the impact of both COVID and the measures that we're taking on people in BC. But all of the data that we have is available to people, and I'm not hiding anything. I'd like to give more as much as I can to people.
Next question is from Moira Witten, the Tyee.
Hi, good afternoon. Thank you so much for taking my question. My first one is, now that we're about a month since Seniors Advocate Isabel McKenzie released her report on the impacts of restricting visitors, among other measures, when can we expect to see decisions made either from you, Dr. Henry, or from the province on how current designated visitors can visit more often and perhaps in residence rooms as well?
Yeah, so the challenge that we are facing right now is that this surge in our communities has dramatically increased the risk in long-term care. And so this is not a time where adding additional people into those risky environments is safe. So we're looking at how we can maintain and expand safely the visits that have been in place and the designated essential visitors, particularly making sure we have some consistency in essential visitors. But expanding to allow more social visits is not going to happen during this risky period of time right now. But we absolutely are looking at how we can make sure that essential visitors are able to visit safely and that those key visits that have been set up are able to happen. But when we have 57 outbreaks, so the visits that are in place right now, that is our challenge.
Moira, do you have a follow-up? No?
Colleague, but given that students... Hello?
Go ahead.
Thank you. I'm just changing subjects for a colleague who has a question. But given that students can't, schools can't control who students interact with, how they interact outside of class, particularly for high school students who may be socializing independently without parental or guardian oversight, why aren't masks mandatory in schools right now, as we're seeing in other provinces with even more difficult pandemic situations right now?
So masking in schools is very much a part of the COVID safety plans in schools. And it is part of the safety plans from the very beginning. And we have, as you know, over and over again, reinforced that that is important, particularly in those areas where people are mixing, particularly for the adults in school situations, where the only place where masks, and if you look at the safety protocols in schools across the country, you'll see that we are aligned. It is when your child, especially young children, are sitting at their desks that masks are not required. And we've encouraged, of course, that young people learn how to wear a mask appropriately, that it's safe for them to do it, and we encourage parents and teachers and everybody to wear masks in those situations where they can't maintain distance with people outside their learning groups and their cohorts. But I mean, your question, if you think about it, you talked about people congregating outside places, and so the mask mandate that we put in place very recently talks about those public indoor places. And yes, children are required to wear masks in public indoor spaces as well as in their schools.